Good morning. My name is Dr. Carl Chalky, and I am the Chief Executive Officer and Chief Medical Officer at the Retina Foundation of the Southwest in Dallas, Texas. Today, we will continue our series of videos where we share with you all how we do the research at the Foundation. This morning, you will hear from Dr. Yi-Zhong Wang, who is the head of our Macular Function Laboratory, and he will explain to us how he is using sophisticated computer artificial intelligence to help us understand and analyze retinal images from patients who have retinal diseases. I hope you enjoy the video.
Hi, this is Dr. Yi-Zhong Wang. I'm the director of the Macular Function Lab at the Retina Foundation of the Southwest. My research is focused on eye diseases affecting the macula, the central part of the retina in the eye, including age-related macular degeneration or AMD, diabetic retinopathy, and inherited retinal diseases. My lab aims to develop new advanced tools to monitor disease progression and to assess clinical trial outcomes through studies on visual function and retinal structure, as well as the structure-function relationship in these diseases. Visual function evaluation is something my lab is very interested in. These evaluations are necessary for us to know how well a patient is able to see and what kind of vision loss they have when compared to normal persons. Now that we have effective treatments for the wet type of AMD, early detection of the conversion from the dry form of AMD to the more advanced wet type is the key for timely treatment. In current practice, patients with high-risk dry AMD often see their doctor every 6 months. If the conversion occurs between their doctor visits, it may not be detected in time for most effective treatment. Visual function evaluation tests that can be used by patients for self-testing at home to detect AMD conversion would be extremely valuable. In the past decade, we have been working to develop new visual function tests for more effective monitoring of AMD and diabetic retinopathy. As we know, patients with AMD often report seeing object distortion. One test my lab has developed is a distortion detection test. In this test, we display 4 circular shapes simultaneously on the screen. Among them, 3 are perfect and only 1 is distorted. The patient's task is to indicate which one of the 4 shapes is distorted. If the patient correctly identifies the distorted one, then the amount of distortion is decreased in the next trial. In this way, the smallest amount of distortion detectable by a patient can be measured. Our research has shown that this shape discrimination test is sensitive to the severity of AMD and diabetic retinopathy. This research has led to the development of a mobile app called MyVision Track. The first visual function self-testing mobile app received the Food and Drug Administration clearance. Patients with AMD can use this app to perform self-testing of visual function remotely. The test results are automatically uploaded and can be reviewed by their doctors to help monitor the disease progression. We continue to work with a medical device company to improve the usability of this app. While visual function testing allows to evaluate subjectively vision loss in patients with eye diseases, in clinic, retinal imaging techniques are widely used to assess disease conditions objectively. Advanced imaging techniques, such as optical coherence tomography, or OCT, provide us with new tools to visualize the structure of the retina in high resolution to help identify the defects caused by retinal diseases. Here we use retinitis pigmentosa, or RP, as an example to illustrate what the OCT imaging technique can offer. RP is an inherited retinal disease that involves loss of light-sensitive cells called photoreceptors in the retina. With the progression of RP, a patient's visual field becomes more and more restricted, resulting in so-called tunnel vision. Using the OCT imaging technique, we can visualize the loss of photoreceptors in RP. Here we have 2 cross-sectional OCT images of the retina. The top image is from a person with normal vision, and the bottom image is from the patient with RP. The red shaded area represents the photoreceptor's out segment, which is part of the photoreceptor responding to light stimulation. When photoreceptors die, their out segments disappear in the OCT images, and the retinal area with loss of photoreceptor will have no light perception. As we can see, the image from the RP patient in this example showed a much narrower area of photoreceptor out segment. This patient has a restricted visual field or tunnel vision corresponding to the narrow area. With OCT images, we can measure out segment areas to assess the progression of RP quantitatively. However, the current automated OCT image analysis software often incorrectly identifies this area, thus requiring manual correction by human graders. This is very time-consuming and costly. Recent advances in artificial intelligence and deep machine learning offer us new tools to analyze OCT images for automatic measurements of retina structures. Deep machine learning works through a model called deep neural network. This learning model is trained using a large amount of data. The machine learns from the dataset through training to extract features, so it can perform a task without a specific set of predefined instructions. Successful deep machine learning often requires a massive amount of data. Since 1982, Dr. David Birch at the Retinal Foundation has been following a large number of patients with RP and other inherited retinal diseases. The foundation also maintains the Southwest Eye Registry, a regional database containing information from thousands of patients with inherited retinal diseases, which is a valuable resource for us to carry out deep machine learning projects. The first deep machine learning project we are working on is to train and test the deep machine learning model to automatically detect photoreceptor out segment in OCT images of RP patients. In the past decade, most, if not all, patients with RP had OCT images taken when they visited the foundation. Working together with Dr. Birch, we have reviewed and identified OCT images from hundreds of patients. We used these images to generate data for training and testing the deep machine learning model. We employed a deep machine learning model designed to process small image patches. To apply this model to process OCT images of RP patients, each OCT image needs to be divided into many small patches. The patches are labeled based on where they are in the OCT image. In this way, millions of labeled patches can be generated for the model training and testing. So far, we have trained and tested 2 deep machine learning models. The preliminary results showed that the performance of the models to identify the photoreceptor out segment is similar to gold standard human graders. These results are very encouraging, suggesting that the deep machine learning model has the potential to replace humans for analyzing OCT images for patients with retinitis pigmentosa. We recently published the initial results, and our work was featured in an international journal. We continue to work on the project. The successful completion of this project will help facilitate our future studies on structure and function relationship. Our goal is to develop effective biomarkers to be used in future clinical trials for RP. Furthermore, we will apply the deep machine learning method developed in this project for analyzing OCT images of other retinal diseases, including age-related macular degeneration. Thank you all for watching this update. I really appreciate your interest in my work. Please stay well.